treatment of eating disorders varies depending on what type you're looking at. For anorexia, oftentimes people cannot be treated well in outpatient settings. When they get to a certain body weight that is critical, you are now dealing with not just a psychological disorder, but you're dealing with the physical risk of someone really going downhill. And there have also been studies that have looked at how thin a patient is and the cognitive distortion that happens at that point, which is probably fueled by poor nutrition and bodily dysfunction. But family therapy is also an important part of it because, as I said, in risk factors, oftentimes there are elements of the family that is also undergirding what's happening for the individual. So that's important to change those messages, help the family realize what they're contributing and how they can be helpful. For bulimia, antidepressants are very effective. Again, there's often a mood component to bulimia. And then cognitive behavioral therapy, where you're focusing on both the thinking process and the behaviors and helping people change what's happening. For binge eating, similar to bulimia, you have antidepressants and different kinds of psychotherapy. IPD is interpersonal therapy. That is looking at how you feel, how you relate to other people, and changing those patterns. CBT is cognitive behavioral therapy, or just behavioral therapy, where you're focusing on the behaviors and getting people to change those, and to work on losing weight, because the risk is different in that disorder in terms of most of the time people are overweight. Another concern in this area, but not a diagnosis, is obesity. And that's defined as a body mass index above 30. It is not, as I said, a diagnosis, but it has lots of negative aspects related to it. The physical reality of having increased risk for lots of medical problems such as diabetes, heart disease, high blood pressure. There is a lot of stigma, obviously, related to being large, and lots of negative stereotypes related to that: being incompetent, being unattractive, being incapable. And so the question is, should it be a DSM? Should it be in the diagnostic manual so that it could get attention from psychological professionals as well? That is something we will be able to. We will talk about that briefly in class, whether it should be a diagnosis. So what are the risk factors for obesity? Again, there does seem to be a genetic component. Again, that might be related to the whole idea of set point, that in your biological makeup you have almost predetermined propensity toward being thin, average weight, or on the heavy side. Culture is very important as well. Servings have gotten much larger in the decades since going out to eat is much more popular, and there is a relationship between the size of the portion, the size of the plate, and how much people will consume. Food is also very available in this country and is a cheap commodity relative to other countries. And we are a country that has one of the highest rates of obesity, not just for adults, but for children. And so having food readily available, and if it is often available at home, that is also an important risk factor. In families, again, parents play a big role in, if they use food as reinforcement to try to get children to obey, to reward children for doing things, that can teach them that food is something you go to on a regular basis. Also, just giving children too much food and letting them eat unhealthy food so that they are constantly eating when they're not hungry, and they don't learn to listen to their own physical hunger cues. Obesity has been called a social contagion, in that we see when you have friends, when you have family, when you have close relationships with people who are obese, you are at risk for obesity. So maybe it's because you have more potlucks or something, but that does seem to be a factor. And we are all familiar with the concept of comfort food, that there are, in fact, there are recipes that are, sorry about that, there are recipes that are actually coined as comfort food. So food when you're feeling down, what does that mean? When I'm not feeling good, when I'm feeling down, when I need a lift, I can go to food. So again, that feeds that idea that food is going to fix things. So what are the treatments for obesity? Usually lifestyle changes are the best first line of treatment. So diet, exercise. As I said, you've probably seen episodes of The Biggest Loser that were absolutely transformative in how these people lived and managed their daily lives. So it can make a huge difference. Some people have such extreme need to lose weight that they have to go with more drastic measures. So there are medications, as you see listed here, that can be helpful. They can often at least be a good initial treatment to try to help people start to lose weight on their own, though they often don't bring off a lot of weight. And the final one is bariatric surgery, which is usually really effective for people who are just grossly overweight. What's important to know is that bariatric surgery, though, is not a treatment that can just be done without major lifestyle changes. So I actually know a health psychologist who does bariatric screenings. In other words, looks at the psychological well-being of people who are being screened for bariatric surgery. They talk about the need for lifestyle changes so that people understand if they don't make changes to what they eat, how they exercise, the surgery can go, the recovery can be poor, and people can gain a lot of weight, and it can actually cause serious medical problems.